When I was in the minority, to pass a bill to regulate Fannie Mae and Freddie Mac. The Republicans in the House passed the bill. No? Are you incapable of a conversation when you're talking and I don't have I don't ask you to trust me. I ask you to have a conversation and not interrupt all the time. Now the point is that that's a fact. I was in the minority from 1995 till 2006. In 2005, I did try to help the Republicans pass a bill. I didn't like it in the end because of what they did to rental housing, but I wanted to restrict, and we were also trying to restrict subprime mortgage lending. We tried to pass a bill to do it. The Republicans got into a fight. The House Republicans, the Senate Republicans, and George Bush, they controlled the whole Congress. So how could it be my fault that no bill passed from 1995 to 2006? In 2007, I became the chairman of the committee. Several months after I became chairman of the committee, we passed the bill to regulate Fannie Mae and Freddie Mac very toughly because it also included a special provision for low-income rental housing that didn't cause any of the economic problems. The Senate didn't pass it until 2008. So those are the facts. Yes, I didn't think there was a problem until Bush started to increase subprime mortgage lending. I understand laughter is a subject of... Let me ask you now, I will interrupt you. What in what I just said you think is inaccurate? Let me just summarize it for you and then you respond. All right, let me summarize it and then you respond. Here's the summary. In 2003, I thought that they didn't have a crisis. In 2004, I objected when Bush increased the percentage of low-income family mortgages they had to buy. In 2005, the Republicans in the House passed a bill to regulate it. The Republicans in the Senate defeated that bill, wanted a different bill. The chairman of the committee in the House, a Republican, Mike Oxley, said that George Bush had given him the one-finger salute, and that's why it didn't happen. Nothing happened when the Republicans were in power. In 2007, when I became the chairman, first time I had the ability to do anything, passed the bill within 6 months. So now what's wrong with what I just said?
You took a picture, right?
What's inaccurate in what I just said? No, I'm going to interrupt you by interrupting me. What in what I just said is inaccurate? Yes, go ahead.
First of all, the Bush administration actually proposed at one point to, I don't even recall at this time what year it was, but they proposed to regulate, they were asking the question if there were problems with the subprime mortgage lending system, and you said you told it 7 times, there's no problem. No, it's your fault, so stop.
No, okay, I'm going to respond now. It's only their fault. Yes, I'll tell you what was my fault. In 2000, not when the Republicans were running the House. I did in 2007. First, I filed a bill to register hedge funds. There was a lot of criticism that there was too much regulation. I backed off. I shouldn't have. But I want to go back. You notice you didn't differ with anything I said. Yes, Bush said he wanted to. He did not raise a question about subprime mortgages. We tried to pass a bill to regulate subprime mortgages. Bush opposed it. Bush did propose regulation of Fannie Mae and Freddie Mac when the Republicans were controlling Congress. The Republicans in the House passed a version he didn't like. The Republicans in the Senate objected. It didn't pass. 2 years later, when Bush was still president, I got the bill passed when I became chairman that Bush wanted. So those are the facts. I only blame the Republicans when they were in power.
Take the question.
What specifically, I want to stick with this. What specifically, please, I think it's important to take some of these things to a logical conclusion. The Republicans were in power from 1995 to 2006. I was not in charge of legislation. When I became in charge of legislation in January of 2007, I helped the committee I chaired pass the bill. So the problem was among the Republicans in the House. Do I blame the Republicans? Yes, when they were in power. I will take full responsibility for anything that happened once we came to power, but that wasn't until January of 2007. Yes, sir.
Okay. My name is Rasim Arikan. I'm a physician living and serving this town. All right. I see patients every day at my outpatient practice, and I'm appalled by the fact that I have full insurance, not insurance, I'm sorry, healthcare rights in my other country, Turkey. I'm a dual citizen. I'm proud to be an American. However, there they give me health insurance for free because I'm a citizen of that country, and they have that in their constitution. Healthcare is a right of the people of that country. You know, how do they explain the fact that if insurance companies, you know, skim me as a physician provider, skim people, and pay menial payments to the providers, and you think they get hundreds of dollars per visit? No, I would rather change oil every day and just go home and watch TV and drink beer. I don't, but I mean, you know, rather than being a physician paying for malpractice insurance. And many doctors are being driven out of healthcare. They are doing something else, doing research, doing, you know, some paperwork, administrative work. Who's going to take care of the people who are talking about the free choice of doctor? There are no doctors. Even I don't have a primary care physician that I can see in this town. I have to go to Worcester, 75 miles, if I need to see my primary care. And I have to pay $75 every time I walk in the emergency room. I told my daughter who had a traffic accident not to go to the hospital. God forbid she didn't die. She said, no, I signed the paper, didn't get in the ambulance. What's this? Is this healthcare or a job? As it is broken down to the ground.
First of all, because different societies have different systems. We're never going to be in the United States, given our traditions and political situation. We're not going to have the kind of health care that many other countries have. I do ask you, though, as a physician, is the quality of health care in Turkey substantially worse than the quality here?
It's perfectly fine. My father had a heart attack, had all kinds of procedures. He's a person who served for his country, and he gets them free because he's retired.
Well, I appreciate it. I think we're not going to get...
It's a public system. It's a public system. That's it.
All right, let me say first, we have partially done that in America with Medicare. And in fact, if you listen to the critics, Medicare is subject, of course, to all of the criticism, even more of the criticism that people make of this bill. The Medicare system involves far more government intervention, control, etc., than this bill does. So I'm puzzled how people who support Medicare... Now, it's true, Medicare was partisan. A lot of people like to get rid of Medicare. I would not. The other thing I would say is some of what you complain about, what you're trying to deal with, the health insurance companies have made some agreements in the course of this bill. Going forward, they will not be excluding people for pre-existing conditions. They will not be doing some other things. So there will be, as a result of the negotiations in this bill, some improvements in the private health insurance. The second point is that's the argument for the public option. I believe in the free enterprise system. But there's an element that's important for the free market system to work well, and that's choice. I have a lot of choice about what I buy as to food or clothing or entertainment or where I live. But with health care, most of us don't have choice. You cannot decide not to get health care. That's why I think that the market system does not work as well in health care as it works in those commodities where the consumer... Because the major power the consumer has is to say no. But you can't say no to health care. That's what the public option will do, and it's a test. There are people who say, oh, but the public option will restrict your choice. Well, then people won't pick it. I think it will save us money because you will take away the element of profit in the insurance industry, but they'll compete with each other, and then we'll see which works better.